Robert Fetter is our last presenter, and he'll be expanding on the impacts for psychiatric populations. Bob has had a career that has taken him into many aspects of behavioral health, from organizational leadership to direct care in areas of substance abuse, mood disorders, and forensic psychiatry. Bob's been involved in many aspects of climate mental health, serving as the American Psychiatric Association representative to the steering committee of the Medical Society Consortium for Climate and Health, chairman of the Behavioral Health Work Group for the New Hampshire Healthcare Workers for Climate Action, treasurer for 350 North New Hampshire, and activities with No Coal, No Gas. And from my point of view, the important leadership role of Climate Psychiatry Alliance, he's on our steering committee, where he always steps up where needed, from testifying on policies, speaking to many audiences on behalf of Climate Psychiatry Alliance, to his talent as host of our author and book club discussions, and much more.
So I'm going to talk about the effects of heat on various different psychiatric patients that we see, and why all of our patients, or almost all of our patients, are at increased risk when the temperature goes up outside. At first, I want to get back to the study that Shui mentioned, which is a really major study in this area, which looked at the northwestern heat wave of 2021, when temperatures were well above 100 for almost 2 weeks in this part of the country, which was almost unheard of before. And this study looked at the likelihood of dying in various different chronic illnesses. So it looked at different populations of chronic illnesses and what their likelihood of dying was compared to the average population. This vertical line here is average risk of dying during that heat wave. And the mental health conditions that they looked at, first was dementia, which you can see actually had a lower than average risk of dying. And that's probably because most of these patients were in nursing homes or assisted living facilities of some sort where they were in protected environments. So that actually served as a protective factor. And then we go up these other non-mental health chronic illnesses. You can see that, varying degrees of risk. Then we get to depression, which is a little bit above average risk for patients with depression. Substance use disorder, even more than the average risk. And then the fourth psychiatric condition that they looked at was schizophrenia. And you can see it's way out here, a way outlier of all these other chronic conditions. And as Shui mentioned, these patients had 3 times the average risk of dying during a heat wave. So I just want to talk about schizophrenia a little bit and supplement some of the information that Shui gave us in her excellent presentation. Although schizophrenia affects 1% of the population, 8% of heat-related deaths are in patients with schizophrenia. So you can see that they're way overrepresented. There's something going on with this illness that puts them at tremendous risk. And there's a number of things that are probably involved here, and Shui mentioned these as well, that the illness of psychosis creates confusion or bizarre ideas relating to heat and assistance seeking. Schizophrenia is associated with homelessness and poverty, which means these patients have limited access to air conditioning and reduced access to liquids, which put them at increased risk. There's also impairment in hypothalamic heat regulating mechanisms that Dr. Levine talked about in schizophrenia. And this is independent of antipsychotic medications. There's something about the illness of schizophrenia itself that impairs hypothalamic heat regulation mechanisms. And then the antipsychotic medications are another significant risk because they also impair hypothalamic heat regulating mechanisms through their pharmacologic mechanisms. And many of these patients are on anticholinergic medications to help with extrapyramidal symptoms, and these anticholinergic medications impair sweating. So there's a number of significant factors that probably relate to this increased risk in schizophrenia. And in addition to Shui's great movie that she showed us, there was a really remarkable story in the Washington Post a few years ago, which followed a patient, Stephen Goodwin, who was in Arizona. And it follows the last week of his life before he was found dead of heat stroke in a parking lot in Phoenix. And it's a really dramatic and incisive discussion of this issue. So now I'm going to move on to major depressive disorder. And if you look at hospital emergency room visits for people with primarily major depression, they start going up when the temperature starts getting around 20 degrees centigrade or 75 degrees Fahrenheit. And there's a linear increase that continues as the temperature goes up. Alex also mentioned that rising temperatures are associated with increased suicide rates, and patients with major depressive disorder are the group that's most likely to reflect this. There's also medication issues involved for people with major depression. Antidepressants, the SSRIs and SNRIs, all increase sweating, which can lead to increased dehydration and further heat stroke problems. The tricyclic antidepressants have the opposite effect. They reduce sweating, which leads to increased body temperature. And more major depressive patients are being put on antipsychotics these days as a supplemental medication. And as we previously mentioned, the antipsychotics directly impair hypothalamic heat regulation. So all of these are factors in increased risk in patients with major depressive disorder in heat waves. Patients with bipolar disorder also can be at increased risk. I was unaware of the data that showed there might be a protective factor for this condition, but I don't think all the studies have shown that. But there are certain things about patients with bipolar disorder which put them at increased risk. Increased activity in the manic state causes increased heat production in the body. Again, most of these patients nowadays are on antipsychotic medication, which impairs hypothalamic temperature regulation mechanisms. Lithium, which is probably the single most common used medication for bipolar disorder, increases the risk of dehydration because of increased urination that it causes, which in turn can lead to lithium toxicity. And this patient group also is subjected to the increased suicide risk with increased temperatures. Patients with dementia, as I mentioned before, the ones who are in assisted living situations are actually protected, but those who are living at home are at significantly increased risk because they have decreased awareness of heat because of their dementia. They also have decreased hypothalamic regulatory ability, which is a function of the illness. They become confused about what to do about the heat if they are perceiving it. And again, limited income can be a factor with this group, leading to reduced access to air conditioning and adequate hydration. Patients with ADHD are at some increased risk, again, because of increased activity associated with hyperactivity, increasing body heat production. And the stimulant medications that most of these patients are on also impair hypothalamic heat regulation. It's unfortunate, but almost every medication we use impairs a hypothalamic heat regulation. Stimulants also reduce ability to sweat due to vasoconstriction. And when you're under the influence of a stimulant, you actually have reduced unpleasant sensations of overheating. You're not as aware of the fact that you're getting overheated. Patients with substance use disorders, this group had the second highest rate of death in that study in British Columbia. A number of factors going on for patients with substance use disorders. When you're high, you have reduced perception of being overheated. Again, homelessness and poverty tend to be associated with this condition, which limits air conditioning and liquids. Methamphetamine and MDMA or ecstasy specifically directly interfere with hypothalamic temperature control. Alcohol increases dehydration. And a somewhat troubling statistic is that 18% of all heat-related deaths, these are deaths where heat was determined to be a factor, not necessarily the primary factor, but a factor. 18% of all these deaths involve drug overdoses. What can we do about this? Well, we can educate each other like we're doing tonight. Hopefully get more of this information included in resident training programs and also educate our patients.